So patients with chronic lymphocytic leukemia, or CLL, are currently treated after chemoimmunotherapy with targeted agents. We call them BTK inhibitors and BCL2 inhibitors. And they were promising for these patients to expand their lifetime. But some of these still get refractory disease or get intolerance for these agents. And there is, at this moment, nothing than doing an allotransplant in fit patients with low comorbidities. So the transplant numbers are decreasing, but still there are. And we investigated their outcome. And well, it's quite the same as in the previous time where we did not have these novel agents. So the outcome is the same. Especially the patients with disease which is responsive to their last treatment. And the majority of the patients in this study had as a last treatment a BCL2 inhibitor. So these did very well. They did not reach, with a median follow-up of 3 years, their median survival. So that's the good news for these patients. Yeah. And well, then there is always the discussion about the timing, because allogeneic stem cell transplantation comes up with a non-relapse mortality, which in this study was, as expected, 10–15%. You always pick up the good patients to try to do such a possible harmful transplant. Well, for these patients, maybe it's better to do it when they are responsive to the last novel agent, instead of treating them first with an ongoing, non-covalent BTK inhibitor, pirtobrutinib, which I think will be available within 1 or 2 years. But that median survival is only, 20 months, so it expands lifetime a bit, but not so long. So if you give it then first after BCL2 and BTK inhibitor, then you get older and older and maybe more comorbidities, and then maybe some of these patients cannot transplant it anymore. So yeah, the question is, and we have to discuss this with other experts, how to place allotransplant in the CLL field. Yeah, and as many know, I guess CAR T-cell is not so effective in CLL at the moment. It's done only in study and a few outside studies. So allotransplant, we think, is still a viable option.